Welcome to Reducing Risk, a series of podcasts from Medical Protection created specifically for doctors in Aotearoa, New Zealand. Reducing Risk looks at key medico-legal issues in our jurisdiction and provides helpful advice and guidance on how to manage those risks. Welcome to today's workshop. We're going to start a two-part series on physician well-being. And this first one is around what organisations can do to prevent physician burnout, but also to build well-being in their staff. As we're all aware and may be experiencing, burnout is common. It often sneaks up on us and can in some cases be devastating. The numbers on burnout in doctors and med students is depressing. According to pre-COVID data, approximately 50% of doctors worldwide are burnt out. This number is true of secondary care doctors in New Zealand. In primary care, the numbers are equally discouraging. In 2016, the GP College survey showed 22% rated themselves as being high on the burnout scale. In 2020, this had risen to 31% of GPs. A recent international study on burnout in primary care doctors in 10 countries, including New Zealand, showed that 57% of GPs under the age of 55 and 40% of those over the age of 55 experienced emotional distress. In this part one, we're discussing strategies to prevent burnout and what organisations can put in place. The reason why we're discussing this ahead of the personal strategies, which is in the second podcast in the series, is that there is good evidence that organisational strategies are more important than personal strategies when it comes to prevention of burnout and promoting wellness. There is a saying that if the goldfish are sick, change the water. And this episode looks at what you can do to change the water. To discuss this with me today are two of my colleagues. We've got Dr. Chow-Yen Chen, who's an anaesthetist working in Auckland, and she works with me at MPS. Thanks for joining us, Chow-Yen.
Thanks, Sam.
And we have Lucy Gibbard, who's a GP in Taranaki, and she's also one of the medico-legal consultants.
Hi, Sam.
Thanks for joining me, both of you. I'm really excited because we've got someone from primary and secondary care, and I think the issues that we face are similar but also a little bit different. Firstly, I thought it'd be good to consider why it's important for organisations to consider the environment that they provide for their workers. Studies show that organisational factors are even more impactful than individual strategies to prevent burnout. And I know in years gone by, organisations have had a tendency to say, well, you need to do something about it yourself. Go do some meditation or mindfulness and that'll be all you need. But studies show that that's not actually what we need. What we need is for a culture change within the environments within which we work. When clinicians are burnt out, it has obviously a very high impact on the provision of healthcare. You get high job turnover, decreased productivity. You get increase in medical error, and therefore we increase our medico-legal risk. And the difficulty is that people are leaving the profession. And it's not only, obviously at the moment there are a lot of people going overseas, but there are people who actually are leaving medicine itself because it gets too hard. And anecdotally, you hear stories of people who are going overseas, and I think part of that is because the conditions are just really tough here. Have you heard that as well?
Yeah, I think it's definitely, there's a lot of feeling in the profession that life is hard, resources are limited, and workload is high, and all those things together tend to make people feel like life, working in medicine's tricky.
Mm. And of course, when clinicians are burnt out, it does impact patient care, and which again impacts the organisations for which we work. And so you end up with a rise in complaints, and particularly HDC cases, which I'm sure we all agree we all want to avoid. And in the ideal world, our resources will match the demands in the healthcare system, but in reality, demand is increasing, and it feels that our resources are diminishing. And you might feel that, well, with that great news, burnout is inevitable. But there are third world contexts where resources are far less than ours and the demands are far greater, and yet people love going to work in those contexts. And rather than burning out, they seem to come back invigorated. So have either of you worked in a third world context or know of anyone who has?
Yeah, I haven't personally, but I certainly know a lot of people who have worked in the third world, and they really enjoy it. And I think you're absolutely right. They come back invigorated, and they sign up to go back again. And it's their own time, their own resources, and they have to beg for leave to go. But they do it. They get the leave. They find the money, and they go, and they really, really enjoy every aspect of it. And I know about 2 or 3 colleagues now that have left the hospital so that they can so that they don't have to constantly ask for leave to go and help out in the third world. Yeah.
So it's possible, isn't it, to work in a really tough situation and yet thrive?
Yeah.
Yeah. So I guess the question is, what do we need
rewarding.
here in order to gain that same invigorating experience? Before we go on and discuss those sorts of things that organisations can do, I thought it'd be useful just to talk about the 6 areas of work. Now, Christina Maslach, who's well known in her work on burnout, and she's the one who created the inventory, which was a validated tool to measure burnout. She proposes that there are 6 areas of work that are drivers that contribute to either burnout or full engagement with your job. So these are the things that organisations can do something about, that can support their workers in order to thrive in the workplace. So we're going to touch on these different areas. The first one is workload and efficiency. The second is control, which includes flexibility and work-life integration. Reward, which is really important for all of us, I think. Meaning, community, and value. So those are the 6 areas that we are going to talk about. So starting with workload and efficiency, because those 2 things are linked. Lucy, how do you think organisations can improve efficiency?
Gosh, I'm sure that's a big question, Sam. But look, I'm sure there are lots of ways we can improve our efficiency. But I think one thing to think about is getting the right person for the right job. You know, we all have strengths and weaknesses. And in an ideal world, we'd all be working in our area of strength. And in any team, there are going to be people who have different strengths and weaknesses. Some people may really enjoy performing procedures. Some people really like outpatient clinics. Some people like teaching or leading. And so actually, one of the things that can help make a team work more efficiently is actually getting people doing the bit of the work that they like. And so if you have colleagues that really, really don't want to teach, obviously giving them teaching roles is going to make them feel stressed, and it's not going to increase their enjoyment in their work. Whereas there's some other colleagues who just love to teach, and you tell them they've got a teaching session this week, and it's yay, great, that's what I want to do. So I think trying to find the right person for the right job and sharing out roles within the team so that people can do actually what they enjoy.
Yeah. I think you can streamline processes and work harder. Work smarter, not harder.
Work harder, Chaya.
That's right. That's all you need to do is work harder. That's not what we want to hear. As if we're not working hard enough already. So if you look at how you're doing things, and for example, in a GP clinic, and correct me if this is not right on point, but rostering a GP to triage patients for appointments rather than the receptionist trying to do this will save time and make the day's appointments run more efficiently, so that people with minor issues that can either wait or be dealt with over the phone in 5 minutes won't unnecessarily take up appointment time. And I know for example, in EDs in some hospitals, they've got a system where there's an SMO in charge, and they will go around with a nurse, and they triage all the patients with regard to what the most urgent test they need is. So they'll get on, and if it's a straightforward presentation, they'll get on and order the bloods, order the imaging that they need, and get that underway. so that the patient can have those tests, have the results come back, and have an earlier referral rather than wait for 2 hours for that first doctor contact.
I was reading in the New Zealand Medical Journal, the latest edition of it, that an eye department had essentially streamlined a lot of their processes, thought about how things are done, reduced the number of visits that patients needed to have for cataract surgery. And they ended up reducing the wait times, and they were able to free up more time in theatre, so more operations got done. And obviously the team had put a lot of work into looking at those processes, which is what worked in departments overseas. But it's had a really significant impact on the number of patients they see. And I thought, wow, if we could all actually sit down and have the time and the energy, and the teams who had the enthusiasm to think about that, there are probably a lot more efficiencies that we could find in the system.
And it is nice to work in an efficiency. It must be quite gratifying to actually think, oh, we're doing a really good job here. We're doing this really well. And you get that great feeling from the patients, the patients who come in and say, oh, I've had to wait 6 months to see you, and they're upset before they've even started. It's much nicer when you're saying, oh, this is good, and people are giving you positive feedback. So those efficiencies do come through on a personal level as well, don't they, of positive feedback, making it feel good to work.
And I think, ideally we'd all like to have correct staff to patient ratios, staff to clinic ratios, and that's the holy grail really. But in this climate where we've got the constant news coming out of Te Whatu Ora that there's no more overtime allowed, whether that's correct or not, there's a hiring freeze everywhere, that we know that that's really not going to happen. So any efficiency that we can make up, I think, will be really beneficial.
And I think feeling masters of our own workplace is part of that as well. If we can actually make things work and get efficient processes, then actually we feel a bit more in control. And we're coming on to that, aren't we, Sam?
Yeah, I think also related to that, if we're working efficiently, it means people working top of scale, so that you've got people, the SMOs need to be making decisions and working in ways that only an SMO can do, rather than, I know that often, if you've got a registrar short, what do? You have to do your registrar's jobs. But if everyone can work top of scale, it makes a lot of sense.
Yeah, and I think if you've got an effective rostering system where you can roster for non-busy periods, I think that's really effective. And I think some of that comes with hiring locums in advance when you know that you're going to be short. But it's a little bit difficult to balance this out with the skill shortage that we have at the moment. And then that goes along with organisational cultural issues of these are the times when people need their leave the most to recharge, but as an organisation, you know that if you give those people that leave, you're going to be really stuck. So it's difficult, hard to find the balance.
Yeah, no, I agree. Very hard to find the balance, but I think it's worthwhile if management can put time into thinking about workload and efficiencies. Saves money, saves energy, people feel more invigorated, I suppose, and less burned out. So let's move on and talking about, you mentioned before, Lucy, about control, which includes flexibility and work-life integration. I mean, we all do want and need, I think, some autonomy over our own life and our workday. None of us like to be micromanaged. So how can organisations maximise autonomy?
Yeah, so one of the difficulties is that how can you maximise autonomy without putting the organisation at risk? Because that's the starting point for any organisation. They're going to say, we want to make sure that we can still function before we give out all this control to individuals, because they're going to do what's best for them, not necessarily what's the best for our organisation. So like you're saying, some individuals will manage their time and be more productive when given that autonomy, but others, they might take advantage of that. And one example is the working from home issue. And during COVID, for example, a lot of our outpatient clinics went online. We used a lot of telehealth, telemedicine to do those clinics. And you'd think that, it really was beneficial for the patients. They don't have to drive in, try and plan their day around this clinic that they have to physically be at for 10 minutes, but perhaps spend an hour in the waiting room and then fight the traffic going home. So there was a lot of that during COVID, but as we've come back from COVID, online clinics have become less of a norm again, and there's more of a focus on face-to-face time. And I don't know whether that's better or not. I know that a lot of patients do prefer to have online consultations if they can.
The question is as well with the clinicians, does it improve your control? Because there are some people who really like coming to work and there are some people who like working from home. And the question is, would you as an organisation say, okay, well, we'll let each clinician have at least 2 sessions a week where they're allowed to do either their admin or online consultations from home? And you may find some say, no, I'd rather come to the hospital, and some who definitely would leap at the chance. And I think that autonomy thing is more about people being able to feel like they can control what they do. And as long as you say, the organisation's not put at risk, so that you've still got someone there who's actually going to examine the patients, I think that is actually a really useful thing for an organisation to consider, how much they can give people that autonomy to make a decision about where they're working.
In primary care, Lucy, do you think that there are still a lot of virtual clinics, or do you think most people have really come back to in-person consults?
I think in general, in our clinic, we're mostly back to in person, but I had 2 virtual sessions. Out of my 12 patients yesterday afternoon, 2 of them were virtual. So it's still there. But to be honest, in that situation, that doesn't change my work environment. I don't think it prevents my burnout. I think that it would be if I was to say, well, every Thursday afternoon, I do a virtual clinic instead of a appointment clinic in the practice. I have to talk to my employer if that's what I wanted to do. But, it might be something that for some doctors that would be a beneficial thing for making their work more enjoyable for them, So I think it just depends on the individual. But I think in general practice, there is definitely this scope to do at least some remote work.
I think the online clinics are faster.
Yeah.
Mostly because you can't examine the patient particularly. And I don't know, for me personally, there seems to be less chit-chat, less socialising with your patients. You tend to get down to brass tacks a bit more quickly. And I find that if you've got a few virtual consults, it actually is a good way to make up time if you're running late, I have to say. I don't know, does that work in the hospitals? Is it actually something that would be helpful, do you think, for the clinicians?
I think like what you guys are saying, having the choice definitely is helpful for having a sense that you have control over your work rather than I have to fill in this many pages and I have to show up at this point and sit at this desk to do this clinic. I was talking to a colleague the other day and I was saying, well, what is it about your work in the hospital that is a gripe for you? And he said, well, you're just not a master of your own destiny. You just have no choice. If you worked really hard all day and you've got through all the patients and you finish your list early, then you'll definitely get 3 or 4 acute cases and you'll end up going home late. So that's just not...
So they're rewarding hard work by more work.
Correct, 100%. And that's how it is. And there's no getting around that.
Yeah, I think general practice is a bit different from that because I think generally a lot of people choose general practice because of their flexibility and in a lot of practices, they'll say, look, as long as you're seeing your 12 patients, we don't mind, maybe you need to start a bit later for school hours or finish a bit earlier for school hours, or one particular afternoon you want to change things around. And in general, with general practice, that you can do that. If you want to get to your kids' sports day, you can do that and then see the patients some other time that week. So I think there is a bit more flexibility as far as rostering in general practice, where essentially it's clinic based.
Do you think that's possible in, for example, outpatients? Is it possible to have glide time, to start clinics later if that suits the clinician? Or is that an impossibility?
Well, I think from the organisation's point of view, they want, because resources are so limited, because the doctor resource is so limited, they can't afford not to make sure that they are working every doctor for all the time that they have them. So it doesn't make sense for the organisation to say, well, you can come in later and stay later, because all the nurses that are doing the admin and all the OBS for the clinics, they can't stay later. They're only there till X time. And if you say, well, I'm willing to do the OBS and stay later, then they say, well, there's no receptionist.
Oh, okay, so it becomes an impossibility.
That's right.
It's hard to be flexible in that situation, isn't it?
Because you've got such a rigid system where you need this many people to do all these jobs for you to see them in clinic. It's not ever going to be flexible.
And that does increase the risk of burnout, doesn't it? Where you just feel like you're a cog, and that you're in that machine, and
That's
it's
right.
and there isn't very much.
This is how it's going to
and
roll.
the autonomy is not really there for choosing how you work.
No.
That means that work-life integration becomes very difficult. So if your child has a soccer game, for example, you wouldn't be able to just organise your life around that, your work in the hospital system.
No, I think it just becomes too hard for the organisation. And I think to work in a team, I think my teammates would understand if my child was sick and I needed to go. But for me to say, well, they've got a soccer game that I'd really need to go to for them and for our relationship, then you could see from their point of view that, well, I've got kids. And,
too hard.
Yeah.
Fair enough.
Yeah.
I guess that is one of the attractions to primary care, because I think that it's obviously much easier for us to be able to do that. So let's talk about reward, which I think is probably a very sensitive topic.
Yeah. And there's no doubt that paying people really well helps morale. The health sector's under a lot of pressure and everyone's aware of that. The recent large-scale pay rises the hospital nurses received, I'm sure went some way to helping their job satisfaction. But then the corollary is that recently we've got all this news coming out that, there's no more overtime, there's no money until at least July. So if it's short, it's going to stay short. How's that differ in primary care or in general practice?
Yeah, well, general practice, don't get me started. I should probably say this is probably, oh goodness, I could say a lot about this. Look, general practice, obviously we are capitated, and capitation hasn't kept up with the cost of living for a long time. And the fees are capped, so you can't increase your fees. So it's theoretically a private business, but the constraints there are so significant that actually, when we have a significant pay increase for the nurses to try and stop them all going to the hospital, that something else has to give within the practice. So, yeah, I think it's really hard. And I think that although it is something that is very important that we stay in a situation where people's remuneration is appropriate for what they do and is good enough so that they can live a good lifestyle where they want to live, I also think that actually money isn't everything. I mean, it's not that uncommon to see adverts for extremely well-paid GP jobs that they're struggling to fill, much better paid than average. And I think that's because actually you look at those jobs when they're advertised, you think, oh, how are they managing that? And they've got huge patient populations. They've got very little support. They're in difficult areas where you may not be able to find school for your kids or whatever. There's all sorts of reasons, but money isn't everything. And that actually, I think, I clearly think that primary care needs more funding. There's no doubt about it. But actually, I don't know if that's coming in primary care either, much as I would love to think that some government is going to value us. But I think at the moment we have to say it's got to be good enough. And actually we've got to look at what actually makes us want to do the job that isn't necessarily, because it's things we can't control. We can't control the funding. So actually we just have to make sure we fund enough and we do our best, I think.
This is getting really depressing, actually, both of you.
Sorry, Sam. I'm sorry, it is a bit depressing.
I think that so clearly the health sector is very strapped in many different ways, and let's face it, there's not a lot of money for any of us, primary or secondary care. But there are other ways to reward people. So maybe we can think about that. Do you think there are any other things that organisations will be able to put into place that does provide a non-financial reward?
Oh, so many that, having your birthday off is one of the ones, or giving coffee vouchers out when somebody's done something particular, little things where you just feel acknowledged and that somebody's noticed that you've gone a bit above and beyond. I think that's what's really important. I remember one of my old trainers years ago saying, keep all the thank you letters you get, because you really need to concentrate on them, and when you're having a bad day you need to just read your thank you letters, because actually someone saying thank you is really, really important. And it's the longer you're in general practice and your patients for longer and people are genuinely grateful to have you there, that's a huge motivation and that's a huge reward.
Yeah, you're absolutely right, because there are other ways to reward people other than money. And I remember once, it's the experiences and the team that pulls together.
Yeah.
I remember we had a really difficult demented patient that needed her broken hip fixed. And it just needed to be a regional anaesthetic. And as you know, it was really hard to position her. She couldn't sit up. And it was getting more and more stressful in the theatre. And I had got a colleague in to help me. And then someone started to sing. They sang a Māori waiata, and the patient calmed down, and we got the epidural in. I think it was a spinal actually. He got the spinal in, and everyone just felt so good after that, because someone sang a Māori waiata and we all sung and joined it.
Wow.
It was a magical moment, and I don't think it happens. You could never orchestrate it. It would have to be spontaneous, but it will only ever come about with a good team. And I just don't know if there is a way to write that recipe.
Yeah, it's interesting because one of our earlier podcasts, we've been talking about toxic workplaces and how difficult that is. And what you're really saying is we need the opposite of the toxic workplace. We need to create a culture in our workplace where team is really important, where we enjoy working with the people that we work in. And you can put up with a lot of bad things if you get on with your team, can't you?
Oh, yeah, so much. So much. And if other people see they see you, they see that you're trying and they see you're putting in the effort and they say thank you, and you're saying the same to your team, that's really very a reason to go to work in the day.
Yeah. You've got this quote here, Mark Twain. I can live for 2 months on a good compliment.
Yeah.
Absolutely.
Yes, it's amazing how good you feel when somebody actually thanks you for what you've done. And that is a huge reward, even though, it's not monetary, it's not anything, but the reality is it's very rewarding. And it's when you get those patients who are incredibly grateful that you think, oh, this is why I do what I do.
Yeah.
This is what makes it worthwhile. Whereas you find that most of us end up ruminating on a mistake we've made or someone's grumped at us and we ruminate on that. And that seems to blow up in our thinking. But as you say, if we can ruminate on the good stuff, the compliments we get, man, I think it would make a difference to the colour of our day.
We were saying just before how we were getting some thank yous for the podcasts.
Yes.
And how really good that made us feel, that people were actually listening to us and writing us thank you emails. That was like, yay. So that's exactly the same thing.
Yeah.
So let's move on to thinking about meaning in our work. I mean, don't we all want that? Don't we all want to be part of something bigger than ourselves? Lucy, what do you think about finding meaning in our work?
Yeah, look, I think that's often why people have gone into medicine, that actually there's an awful lot of meaning in primary, secondary care, in all areas of medicine. And often that's why we're there in the first place, to know that we're making a difference. And that's actually really important for most of us. And that Theodore Roosevelt quote, far and away the best prize that life offers is the chance to work hard at work that's worth doing. And look, we are all working hard, but we definitely have work that's worth doing. We have a lot of people who are in a better position because of receiving medical care. And so, look, for most of us, that's a very core value and driver in why we're at work. And actually, some GPs have this area of special interest thing as well, where they do some speciality areas for some of their day, and that might be women's health or minor surgery or dermatology or whatever it is. And there's an interesting study Shadowfelt did in 2009 that found that physicians who spent at least 20% of their time in an aspect of their work that was most meaningful to them had a rate of burnout that was roughly half that who spent less than that. So the more meaningful work you have in your week, the less likely you are to be burnt out. So then really it gets to that point where, how do we find meaning in our work, or what part of our work is meaningful, and how can we, develop that area?
Yeah, and I guess that's why some of my colleagues go to the third world and volunteer their time and resources to help, because they feel that that's meaningful work for the patients in those areas.
And some people it's teaching.
That's right.
They find that teaching's very meaningful, and they really like passing on their knowledge or watching young clinicians learn. And for other people, it's that area of special interest where they like to have that thing that they do each Wednesday afternoon. And that's the bit of their week that they look forward to doing because it's their, travel medicine clinic or something that they're doing.
And I think it comes back. One of my friends said that they had taught one of their registrars that one of the more important things to think about if you get that critically really sick patient who's likely to die, one of the first things to think about is to call their relative, to give them time, to ask them to come. And then they had a really sick auntie, and they got a call from this registrar who was now a consultant, who said they didn't know that was their relative, but they phoned them and they said, your relative is really unwell and you need to come. And it just came back.
Wow.
So it was very meaningful to them.
Yeah, absolutely.
Yeah, so if we can, I think it is very important for all of us to find meaning in our work. We spend so long at it in our day. Who was it was saying we do spend more time with our colleagues than our spouses, and that's probably true in a lot of cases. So how do we find meaning if you feel like it's lacking in your current environment? Do you think that's possible within a hospital context?
I think so. I think that it will always be there, and perhaps when you least expect it. So I think it's about not giving up hope and still working with the people you really enjoy working with, and take some time, even if it's on your way to the bathroom to say hi to them and to reconnect. I think all of those small things that you can do will help, because I think a lot of our work is made up of the people we work with. Yeah.
But I think in medicine we are so lucky. It is a very privileged position to be involved in people's healthcare,
Yes.
and to be involved in their lives and to hear their stories. And it is an extremely privileged position. And sometimes when we're in the middle of just feeling completely overwhelmed and running half an hour late, and you've got a task list that's coming off the bottom of the screen, sometimes you've just got to remind yourself that actually, why am I doing this, and why did I want to do this, and what a privilege it is to be a doctor.
I think that's really, that's very positive, and I think that's worthwhile remembering, because oftentimes, exactly how you say, the day is just going terribly. You've got a cesarean section list and it's just not going well. And then you've got the dad that's so nervous that he goes, I'm going to name my kid Kim Jong Donald Trump. And then everyone laughs in theatre and you think, oh, this isn't so bad.
Yeah, you get good work stories, don't you?
That's right. They make a joke. If he can make a joke and find some enjoyment in his...
I hope that was a joke.
It was a joke. He was
What
very
are your children's names, Chaya? That wasn't your husband, was it?
That wasn't my husband. But yeah, so if your patients can find it in their stressful time to make a joke, we do have a privileged job.
We do.
Yeah.
I think if you can find that 20% for you, it's enough. It's enough to make your week something to look forward to in your week. And I'm sure, again, a lot of things are easier, I suppose, to organise in primary care. But, I don't do minor surgery anymore in my practice. And so I give it all to the people who do. And there are probably some people in your practice who do enjoy that. Or, for even in the hospital system, some people might prefer these types of clinics, a colposcopy clinic versus a something else clinic, and is it possible to be rostered to the clinics that you enjoy more?
Yeah, I think that is absolutely possible, because in anaesthetics we all hate clinics, but there are a few of my colleagues who really enjoy them and they get rostered to them, and it's about being grateful for that, I think.
Yes.
That's what they enjoy, so I should be grateful that I don't have to do as many.
And I would have thought that within a department it's possible to collaborate with your colleagues to work out, I'd like to do these if if you're happy to do those sorts of this type of work. And it just takes a discussion and a will to make it work.
Yeah. It's about communication.
Yeah. Let's move on and talk about how we build community within the team. Any thoughts around that?
Build the sense of the team. And so some departments will have, team building exercises, and we organise annual catch-up dinners, or we have in our department the Great Anaesthetic Bake-Off, where everyone, it's actually called that, yes, where everyone enters a competition and there's taste testing and people come in on their break and they test and they cast a vote. So I think all of that helps. Yeah.
Yeah, I'm trying to make sure that everyone feels part of the team. It's really easy to feel a little bit cliquey sometimes in big departments where lots of people seem to all know each other and then the new person doesn't, or somebody else feels a little bit. So it's really important that whoever's in charge of that team is very inclusive, so that those invitations, they make sure it goes to everybody and that everyone gets included, and that the Great Anaesthetic Bake-Off isn't always on somebody's day off that they aren't there or whatever it is. So I think making sure that everyone feels being very inclusive about inclusive is the word, not exclusive, isn't it? You want to try and include everybody. And look, I think a lot of departments do those things, the coffee times and the lunch times and the social outings, and all those things, bowling or whatever else you're going to do, because you just get to know your colleagues on a social level better. And then when you're actually dealing with stress in the workplace, you have a much better understanding of them when they're reacting, and you're much more likely to be a little bit more tolerant, if things aren't going so well.
I think it's also easier if you've got a clinical dilemma or you're stuck for some reason. It's easier to go to your patient, to your colleague if you've just had a cup of tea with them.
Yeah.
You've gotten to know them socially. So you break down the barriers, and I think teamwork improves, and so patient care improves.
Yeah, that's absolutely true. Absolutely true.
And the other bit is about community, is that whole thing about managers, because, traditionally doctors and managers, there's a little bit of a barrier there, and sometimes it's a them and us kind of adversarial kind of idea. But actually, if the manager is part of the team, and the team members have really good access to the managers, they can just go and sit down in the office and have a yarn. There's studies that show that having a good relationship with your boss is actually really important in protecting against burnout. So actually, if you're the boss, you actually should be thinking about that as well, that your team needs you to be there, and that means being there in the coffee room and hearing what people are talking about, and having that door open so that your team members can come and talk to you, because if they get to know you and kind of develop that trust, actually that's going to protect them from burnout.
In terms of communication, do any of you have a huddle prior to your session starting or prior to theatre?
Yeah.
Do you find that helpful?
I think it does. I think it's still, I think people become very cynical about it, but I think it's definitely very helpful in theatre. And there is a mandated huddle in our theatres that happens every morning. You have a round of introductions of everyone, and then you talk about what's on the list and whether you've got all the required equipment. So I think it's definitely helpful in theatres, especially when you've got turnover and you might not know all the staff present.
Yeah, general practice often has huddles as well, including all the team members. And I think it is just a good time to touch base. General practice particularly, you're often in a room by yourself with a patient, it's not really a team game, general practice. And so it is really nice to have times where you're going to catch up with people and just say hello, really. Otherwise you find yourself in your room all the time. And yes, you're seeing patients and you're using your social interaction that way, but actually it's nice to feel like you're part of a bigger team.
I think one of the values of having a huddle is that it breaks down the barriers of communication, and it means that everyone who's part of the huddle has an opportunity to speak. It doesn't matter where you sit in the hierarchy. So I think huddles can build community. So if we move on now to values, ideally the organisation's values and the individual's values are aligned. I'm not sure whether that's necessarily always the case, but Chow-Yen, do you have any thoughts around that?
Yeah, so every team and organisation will have unspoken or lived values, even if they aren't articulated. And you'll see commonly companies will have values, organisations will have values. Te Whatu Ora has values, and they're all written down. And I think it's helpful to have them written down, have them articulated, even if they are aspirational, because setting a goal to aim for is always going to be helpful, and it helps to bring us together as a group to aim for the same set of values. And research has shown that people prefer to work in organisations whose values align with theirs. And in health, this usually involves patient-centred care. And linked to values is fairness, how people are treated. If the squeaky wheels are the ones who get everything they want, or some people are exempt from the rules, and that can quickly generate resentment. And of course, disgruntled employees generally aren't going to be as productive.
I think it's really important, though, that the values, whatever those values are true values. They're not just something written on the wall, that actually they're lived and that actually you see them working. So if the value is, professionalism or, kindness or whatever, you have to see it. don't you? You know, it has to be real rather than just written on the table napkin or whatever it is. You know, it's got to be a real. You've got to be able to feel it.
Yeah, and I think you're absolutely right. I think at the moment sometimes there's a sense that the organisational values, because, for example, Te Whatuora is so big, it's hard to feel aligned with the set of values espoused by such a big organisation, especially when we're all practising in times of resource constraint.
But it might be that even, you know, you're right, a hospital is a massive organisation. It's a big organism, isn't it? But what about in the department that you work in? You know, we work in teams, and even though you may not have an influence over the hospital's values and the culture there, everybody has an influence, I think, within their team, even if you're not the leader of that team.
That's true. That's absolutely true. That's a very good point.
And we tend to want to work in teams where we're all pulling in the same direction. We have the same goal and we want the same things. You know, so actually I think those values, as you say, may just be the values of your little part of the organisation. But it's nice to feel that you're with people who share your values.
So if we think about the idea of civility, that can be a culture within your team. And if we think about, well, what is incivility? Incivility is seemingly inconsequential, inconsiderate words and deeds, and is it's not objective, but often the interpretation is in the eyes of the beholder. It's about how we interpret the way we're treated. So if we just think about civility for a moment, do you see it, and how important do you think it is, or how, you know, what sort of things embody civility in the workplace? Lucy?
Yeah, well, actually, the civility is of being kind and nice to each other, really, isn't it? And using polite phrases, saying thank you and saying please, and using people's names, and all those things that actually make you feel that they may be social constructs of how we deal with each other, but actually when you use the civilized and the more person-centered way of communicating, that makes people around you feel better.
Yeah, and you know, our listeners might be wondering why we're talking about civility, and it comes up a lot in surgery and operating teams, because incivility shows, there's a study, for example, linking surgeons' behaviour to surgical outcomes. For example, patients whose surgeons receive any report of unprofessional behaviour in the 3 years before their operation were more likely to have post-operative complications. So these are issues that directly affect patient outcomes. So in this study, they were shown to have more wound infections, pneumonia, blood clots, renal failure, for example. So if they had 3 reports of unprofessional behaviour, it led to an 18% increase in risk. 4 or more reports led to 32% increase in risk.
That's an interesting way of looking at it, isn't it? That actually unprofessional behaviour causes surgical complications. And it's hard to see how that relates. Maybe those doctors, when something's going wrong, their juniors won't speak up to them and actually say, oh, I think you shouldn't be doing that, or I think this is wrong, or shouldn't we be doing this? Maybe it stops that communication within the team being so good.
Yeah.
Because it's hard to see how directly, you know, somebody who's rude to their juniors, how that causes more wound infections, isn't it?
Yeah, well, I worked a long time ago, I worked with a surgical colleague who was really a nice person socially, but in theatre sometimes with an unfamiliar team he would get quite stressed and he would try and micromanage them, and we're talking about things like, he'd say stuff like, I don't like you, I don't never have people standing on my right side, or you know, you didn't drape the patient in the way that I wanted you to, but having never explained how he wanted them draped. So, and it went on And it was a lumps and bumps list, so just removing small skin lesions. And I've given this example before for one of our podcasts, but by the end of the list, so with a minors, you always start with local anaesthetic and a marking pen, and these were experienced scrub nurses. But by the end of the day, they'd start a new case, and the nurses didn't know how to get together the local anaesthetic and the marking pen because there was so much incivility that they could no longer function.
Wow.
It's crazy, isn't it?
Yeah.
Intimidation is real, isn't it? I mean, I suspect he wasn't intending to be intimidating.
No, absolutely not. He was just stressed and saying, well, I want you to not stand at my right side. I want you to pass me the suction in this manner, not, that manner. But because of so much micromanagement, it just became, they didn't know how to do the first thing that they were meant to do on every case was pass them the marking pen and the local.
So you can imagine that, as you were saying, Lucy, they'd be too scared to speak up if they saw that he was about to make an error.
Absolutely.
They'd be too scared to speak up.
Yeah. I haven't given the antibiotic yet.
Yeah, it's
too
hard,
scared to
isn't
speak up.
I mean, there is definitely studies that show that, civility reduced in the workplace causes a reduction in errors and emotional exhaustion and cynicism and burnout. That actually if you work in a team that are civil to each other, you actually have better safety behaviours. So that is definitely drawn out into the research as well.
Yeah, I think one of the important things is that civility is it's free, it's simple to do, and you can actually change a culture. I mean, even just smiling and saying hello is really important. And interestingly, there was a health system overseas where they introduced a civility program, which was called the 10-5 Way, which was initially introduced in the Ritz-Carlton hotels. And what the hotel did was they trained their employees to make eye contact and smile at the person walking down the hallway if they were in 10 feet. Within 5 feet, they were trained to say hello. And when the health system introduced this into their hospitals, they found that there was better clinician engagement, improved patient perception of quality of care. So the patients felt that their care was better, and so they made more recommendations to their friends, so the hospital got more referrals, which is quite an interesting thing, and it's just a very simple but a significant cultural shift. I travel around a bit around New Zealand with work, and staying in a hotel that I don't normally get to stay in. It wasn't a real expensive, fancy hotel, but I noticed that this is exactly what they did. All of the staff made eye contact, smiled, and said hello to me as I walked past. And I can tell you now, my impression was, wow, what a great hotel.
Fantastic.
I know, and I just think, when you're stressed on the wards or seeing patients, sometimes the last thing you can think about is smiling at somebody, right? Because, you're under stress. But actually just a small thing like that can change the atmosphere, I think, in a consultation. Yeah. And patients who like you, patients who think, oh, you're a warm, friendly person, are much less likely, I think, to complain.
And also patients do extrapolate that into their feeling that the doctor's competent.
Yes.
The trust and the belief in, they think, I'm happy with this doctor. And this is a really great doctor. And actually there's no particular evidence that they're better than the grumpy doctor.
That's right.
But actually the patients feel that those are better, more competent doctors.
Yes.
Crazy. Not crazy, understandable really, isn't it? But it's as you say, it's a very simple thing we should all do. Note to self tomorrow.
That's right.
Smile,
say hello.
Smile at everyone.
Yeah.
And say hello.
So I'm sure there are lots of other values that if you think are important to introduce into your team, that you can do that. And I think everyone, as we've mentioned earlier, do want to work in a place where the team's values align with their values. I think that's important for all of us for work. Well, I think we've covered quite a bit of ground, and we've obviously not found answers for everything because it's a big ask, really, to be able to change culture, to be able to create an environment where everyone, the staff are really happy and thriving when we're under such constraints. I am hopeful, however, though, that the health system will improve, that the New Zealand economy will improve, and so that, all of those things will improve and get better. But there are a few things that you can do now. And so some of the things we've talked about, we covered workload and efficiency. We've talked about control, including flexibility and maybe allowing some work-life integration. Think about non-financial reward for staff. People want to derive meaning from work. So think about what is the 20%. What's your 20% that you like to do? And maybe you can try and organise it that you spend more time doing the things that you really love. Building community is often, it's not expensive, it's easier to do, and really powerful in terms of building team, and improves patient safety. And then we talked about values and civility. Lucy, do you have any last words?
The one thing I was going to think about was actually leadership, which we haven't really talked an awful lot about leadership, but a lot of this, when we're looking at how departments function or how teams function, it often hinges a lot on the leaders. And it may not be the general manager, it may be somebody in the team who is the leader. Do you know what I mean? And it may be a junior in the team who's just a natural, someone who actually holds the team together, and how much we need to value those leaders, and how much those leaders need to be cognizant that what they do makes such a big difference. And if you are a practice manager, or you are head of an outpatient clinic, or whatever it is, that actually people are looking at you, the way you behave and the way you, the values that you're bringing. And it's really, really essential that those people walk the walk, and live the words that are on that value statement, because it actually makes a huge difference when you see the people at the top doing it.
Yeah.
Have you got any last words, Chow Yen?
No, I say have some hope for the future.
Yes.
Because actually, like all the things we've talked about, they're free.
That's right.
Yeah.
So there are things that we can do. We don't have to feel entirely powerless,
No.
even though there are some significant things that we can't change.
Yeah.
There are some things that we can.
I feel more hopeful from our discussion.
Yay!
That's good. That's good. So thank you for listening to this podcast, and I do hope that it has been helpful and a little bit more hopeful for you. We look forward to catching up with you in part 2 on preventing burnout and what you can do as an individual. If you like the Medical Protection podcasts, please subscribe and leave a review. If you would like a podcast on a specific topic, please email nzpodcasts@medicalprotection.org. Thank you, Lucy, and thank you, Chow Yen. We'll see you on the next podcast.
And thank you, Sam.
Thank you,
We're
Sam.
thanking our team members. I value you.